Most people don't realize that their spine is out of alignment until it's already causing pain. But pain is actually the last signal that your body gives you. The early signs are much quieter, and if you know what to look for, you can actually catch these problems years before they become chronic. Hey everyone, I'm Dr. Jake, and in today's video, I'm going to show you how to actually tell if your spine is misaligned. Not by guessing, not by stretching it and just hoping for the best, but by understanding how your nervous system responds when the spine isn't moving or functioning the way that it's supposed to. We're going to cover the subtle signs that most people overlook, a couple of simple self-checks that you can do at home, and why your body compensates long before it hurts. If you stick with me to the end, you'll understand alignment in a way that finally makes sense. So why alignment matters in the first place. Let me start with something most people don't realize. Your spine isn't just a stack of bones. It's the protective housing for your entire nervous system. That means every level of misalignment doesn't just change posture, it changes nerve signaling. When the spine loses normal structure, the nervous system shifts out of efficiency mode into stress mode, even if you feel totally fine in the moment. That's why someone can say, I'm healthy, I don't have any back pain, but still have chronic tightness, fatigue, poor sleep, headaches, or even digestive trouble, because the body is compensating long before it actually complains. These are the top early non-pain indicators of alignment problems. One shoulder might always feel tighter than the other. You're constantly stretching the same area and it always comes back. Your neck is stiff in the morning but then loosens throughout the day. You crack or pop your own neck or back for relief. You fatigue quickly just from sitting or standing. One hip rotates or one foot rotates outward when you walk. None of these are random. They're your nervous system telling you something is overworking, something is out of balance. The body is a master compensator. I always tell patients, the body never does anything quote unquote wrong. It's always adapting. If a joint stops moving correctly, another one moves extra to protect you. That's why people feel tension where the problem isn't. The tight area is usually the compensation. The misalignment is typically upstream from that or somewhere else entirely. Let me walk you through a couple of quick things that you can try at home. These are not a diagnosis, but they're early clues that your spine isn't working as efficiently as it could. So number one, head position. Stand in a mirror. If your head naturally sits slightly forward or tilted to one side, even a little bit, that's a neurological compensation pattern, not just bad posture. Number two, weight shift. Close your eyes for 10 seconds while standing still, and if you shift your weight to one side or feel more stable on one leg, your pelvis and lumbar spine are likely compensating. And then number three, range of motion, asymmetry. So gently turn your head left and right. If one side feels tighter, heavier, or blocked, that's the nervous system limiting movement to actually protect you. Notice none of these involve pain. These are all checks of function. Alignment is lost way before discomfort and pain actually shows up. Now we're going to walk through what causes those patterns and why they don't actually fix themselves, and how we measure them neurologically in the office, and why this matters not just for adults, but for kids as well. Because by the time an adult spine is compensating, those patterns typically have been there for years and years and started much earlier in life. So why the body doesn't fix itself? So here's the million-dollar question. If the body is so intelligent, why doesn't it just fix the misalignment on its own? The truth is it tries, but when the underlying structure has shifted for such a long time, your nervous system begins to normalize dysfunction. It stops recognizing something that is off, even if it is. Think about like your car's alignment. If your wheels are off, you can still drive straight, but the steering wheel will always be turned slightly, and over time, that imbalance wears down your tires unevenly, and much more things start to go wrong after that. Your spine kind of works the same way. You can still move, you can stretch, you can even exercise, but the stress is unevenly distributed. The muscles tighten, the joints compress, and the nerves start sending distorted signals. Eventually, pain shows up, not because your body broke, but because it ran out of ways to compensate for that. So, how we measure alignment. There's no guesswork in our office. We don't want to guess about your spine when we start working on it. We measure it. We use a combination of neurological static EMG scans in office and x-rays to see how the spine and nervous system are actually functioning. The static EMG scan looks at how much muscle activity is happening to keep your spine upright. And when we see areas where the muscles are overactive or completely underactive, it tells us that your brain is actually overworking to stabilize the spine. Then with x-rays, we can actually see the structure, the curves, the alignment, the balance of the spine. It helps us to determine if the problem is purely in the muscles or if it's actually in the foundation itself with a shift in the spine. We put those two together, the structure and the function. It's like turning the lights on in a dark room. We can finally see why somebody's body is stuck in a pattern and what it'll take to actually start to correct it if it's possible. Now here's where it gets even more interesting. By the time an adult shows these signs, the body has typically been adapting for years to create those issues, and sometimes decades. And in many cases, those patterns actually start during childhood. Think about all the little things that impact a developing spine. Kids fall, sports, backpacks, screens, even birth stress. None of these might seem major on their own, but the nervous system remembers all of that trauma. That's why we love working with families. Because when we help to restore normal alignment and nervous system function early, we're setting up kids to grow and develop without those compensations that cause chronic issues later on. This is also where corrective chiropractic care stands apart. We're not just adjusting to make you feel better, we're retraining your spine, your nervous system to actually hold better alignment over time. It's the difference between just patching a leak and actually rebuilding the foundation so that the house doesn't shift again. That's why we measure before, during, and after care to make sure that your body is actually changing and not just feeling temporarily looser. So if you're watching this and you recognize any of those early signs, the tightness that keeps coming back, the shoulder that always drops, or the feeling that your body's working harder than it should, it's probably time to get checked. In our office, we start with a full neurological scan and structural assessment to see exactly what is going on. It's a simple, comfortable process, and it helps us to find the root of the issues before it becomes something even more serious than it already is. And if you're a parent, I'll say this. One of the best gifts that you can give kids is a nervous system that's functioning at its absolute best. The earlier that we identify these patterns, the easier they are to correct, and the stronger the foundation will be for their health. So whether you're dealing with tightness, fatigue, or just want to make sure that your body's truly aligned, balanced, and functioning at its best, don't wait for pain to be your signal. Your body's been whispering long before it starts yelling. If you found this video helpful, make sure to like, subscribe, share it with somebody who might need to hear it. In the next video, we're actually going to talk about the top 5 signs that your posture is aging your spine too fast and how to actually slow that process down naturally. You don't want to miss it, so stay tuned.